Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement. Welcome to Cancer Stories. The Art of Oncology presents Sharon Lawrence reading the essay Spring by Melanie Seal, published July 10, 2017.
She came when the ice was still on the ground, having traveled from a place far removed from the frozen land that she would now call home. After her long trip, she immediately presented to the emergency room, hands and feet raw and peeling from the toxicity of chemotherapy. Upon meeting her, I was struck by her vivacity. She was bright, pleasant, and engaging, despite her physical condition. She told me of the tremendous suffering that she had endured since her diagnosis of cancer, but remained upbeat and hopeful that she would continue to fight against her illness. I reviewed the notes of how she was diagnosed while pregnant with her third child and was advised by her physicians to have an abortion, given the locally advanced nature of the disease and the requirement for intensive therapy. Her pregnancy had been terminated, and she had experienced disease relapse shortly thereafter. She had begun palliative chemotherapy, but told me that she only received a portion of the doses that she actually required because she did not have the money to pay for her full treatment. As I examined her, she inquired about the nature of the lesions that covered her chest. They were angry and red, an outward presentation of the same malignancy that was growing uncontrollably in her liver and lungs. When she asked me what they were, I explained that they were from her cancer. And as her tears came, I wondered if anyone had ever broached the topic of prognosis with her in the past. I would come to know, with time, that this is a discussion that we would have frequently during the course of her illness. She had 2 young children who would occasionally come to the clinic with her when she attended appointments. They had her eyes. The family resemblance was clear, and it was a pleasure to hear their cheerful voices in the waiting room, a place where the quiet anxiety of many is often palpable. As the months rolled on, her disease began to progress, and we explored new treatment options. Chemotherapy took its toll, and despite her young age, her bone marrow slowly began to lose its reserve. One constant, however, was her spirit. Her presence seemed to permeate through the clinic. When she laughed, her happiness, it filled the room. When she cried, her situation would weigh on us all. One day, during a routine appointment, she told me that she would like to have another baby. I was surprised. Didn't she realize the gravity of her situation? As I re-examined our conversations in my mind, I knew that I had been very clear about the trajectory of her malignancy. Perhaps she felt that I had not been clear enough. I knew that she could understand the words I was saying, but I began to realize that she did not believe them. Ultimately, the cancer progressed during the treatments with the last regimen, and I held little hope that we could keep things under control. Her performance status declined, and she was admitted to the hospital. She remained intent on conquering this cancer and would challenge any unsuspecting house staff who dared suggest that time was short. On the last day I saw her, she was quiet, calm, and frail, weakened from the effects of her medications. She could no longer get out of bed, and it was obvious to us both that she would never see the outside world again. The days had turned colder now, and it would not be long before the ice returned. I struggled to maintain composure as we chatted, though I knew that we were saying goodbye. I was pregnant with my third child and due to have a baby soon. As I went to leave, she softly said, "It's a girl, you know." And I smiled and explained that my husband and I both thought that we were having a boy. We had 2 little boys at home and felt destined to have another. She brightened, and I saw that flicker of determination that I had once come to know so well from our many visits. "No," she replied, "it'll be a girl." A week later, as I prepared for another sleepless night and waited for my baby to arrive, a message came. My patient had died earlier that day. Despite my knowledge of her prognosis, the news still felt shocking. I could not help but think of her children and how they had just lost their mother. Only a few hours later, I was in the case room. As my baby took its first breath, I heard my husband say the unexpected words, "It's a girl." Time passed, and with the promise of spring in the air, I went for a jog around the lake near my home. It felt glorious to be alive on that cool and bright day. As I lifted my face to the sun, something caught the corner of my eye. There they were, laughing and running. Her 2 children, those unmistakable eyes shining. And they danced around their father as he watched with adoration. They were there without her, yet they could share this happy moment as a family. As I headed home, I thought of the darkness of cancer, what it takes from us, the coldness that it can bring to the world. Oncologists bear witness to the many winters experienced by patients and their loved ones, the profound grief that sets in as a patient dies and the struggles the family must face to cope in the aftermath. It is the honor of being present during some of the most intense moments of the lives of patients and their families that drives our work, which inspires us to search for answers to a disease that continually questions our knowledge and beliefs. But on that day by the lake, I saw something that the cancer my patient endured could not destroy: strength and resiliency of the human spirit. And I was reminded that with the arrival of spring comes a new hope.
I'm Lydia Shapira, editorial consultant for JCO's Art of Oncology and your host for Cancer Stories. With me today is Dr. Melanie Seal, Assistant Professor of Oncology at Memorial University and a medical oncologist in Newfoundland, Canada. She's the author of Spring, published online March 31st of 2017. Melanie, welcome to our program.
Thank you so much, Lydia.
So I usually start with this question, what are you reading now for fun?
So I like to read. It's a way to escape the busy parts of the day, and I usually like to read at night. And I like to read a variety of things, mostly to kind of relax, particularly in this line of work. Sometimes you can have difficult moments during the day, and reading is a way to kind of unwind, particularly before I go to sleep. So I read a variety of things, but I usually try to keep it a little bit light. The most recent book I read was a good book. It was a book about books, and it was The Storied Life of A.J. Fikry by Gabrielle Zevin, and I enjoyed that book. I also have 4 kids, aged 2 to 9, so a big part of the evening is reading to them, and so we're really into Harry Potter these days.
That's delightful. It brings back many happy memories. And may I ask you one final question about reading? Do you like to read books or do you read screens?
Definitely books, and I know that's not the most environmentally friendly approach, but I definitely love picking up a book or an actual newspaper. I definitely prefer that to a screen, but I know that's old school, and maybe I'll change my ways in the future.
Funny. So let's talk about this beautiful, moving essay, Spring, in which you honor a very special patient. Can you tell us briefly what the story is about?
I think the story is about a number of different things for me. One, this patient really stood out in my practice. She had a very special personality, and I think we had a very special bond. So the story is first and foremost about her and I and the experience that we had during her cancer journey. But I think it also talks about what we do see as oncologists in our day-to-day work is the kind of sad, intense parts of the career, but also maybe the hope that can come out of it. And a lot of times we are going through the process of end-of-life care with patients. We see a lot of the sadness and the grief. But once patients die, we many times don't know what happens to their families or how they cope. And in this situation, I was given this very unique opportunity to see her young children after she had passed away in a context that I, in my mind, had not really visualized. I hadn't really pictured them out happy playing. I just pictured them constantly surrounded by sadness and grief because I thought about them a lot after she died. And when I had that moment where I saw them playing, it was very profound for me, and it gave me hope. And I think coupled with the fact that the winter was leaving, the spring was coming, it gave me a kind of renewed faith that we can do this for our patients, that not only do they teach us, but hopefully we can do better for them in terms of improving their quality of life and the time that they have, that there's hope for all of us in this process for a disease that can be so terrible.
As a reader, I found there was a beautiful matter-of-factness about the way you described your own grief and loss and all these external reminders that there is a life cycle and time just marches on. I found that the way you use the timing of your pregnancy and the delivery and the marching of time, helped the reader deal with something that was really heartbreaking, this young woman's intense suffering. And I wondered if writing about it and thinking about it in these almost natural ways helped you perhaps process some of the emotional load you must have been feeling.
Thank you for your comments. I think that writing definitely does help, and how it really starts for me is I just reflect, and I don't know that I'm going to write it down. It's more that I just think about what has happened, and I thought about this patient and her scenario and her situation a lot. And then over time, I started to realize that my thoughts and reflections started to form a story. And once I realized that in my mind it had become a story, I had this intense urge to write it down. I really had to just get up and write it down. And actually, I was trying to go to sleep one night, and I couldn't. And I got up, and it came out. So I think the thoughts had been there for some time, but it really all of a sudden took the form of a story, and that's when I felt this is important to write down. And when I did, it did feel therapeutic, and it did feel something that I could look at, something concrete, and kind of read and look back and think about, but more in a concrete form.
Interesting that this patient is clearly dear to you and has left an impression, and she has no name. Was that a conscious choice?
Yes, I think it was. I feel very protective over her. She was such a wonderful woman and had a very, very sad, tragic life towards the end in everything that she endured. And I just felt I wanted to kind of protect that in some way. And I didn't want to get hung up on the logistics of the name or the country she came from, the regimens that she was on. It was more so her and her essence. And so that was kind of the approach I took.
Yes, I see that, and it worked so well. You really do honor her story, and the reader comes away really understanding all the hardships, the lack of money for treatment, the enormous effort she put into it. And that brings me to one of the most poignant lines when she says, as she is approaching perhaps the final weeks or months of her life, that she wanted to have a baby. What do you think she was saying there?
I've thought about this, and I don't know if she was saying that because she mourned the loss of her third baby, which she terminated that pregnancy when she first found out she was diagnosed with breast cancer. I don't know if it was because she had children and was a young woman and was clearly a very involved mom, if she just longed to have more babies, that indescribable feeling that many women experience, that, they want to have, more children. Or maybe even if it was related to the fact that, maybe on some way it could say, I'm sorry, cancer, I'm not going to let you control my life. I'm a young woman, I want to have a baby. And maybe it was a way of her fighting against this disease. I never really tried to get to the root of that too much, and so I often wonder what was her thinking. And I know that it was an intense desire. I feel that she very strongly wanted to have another baby.
Yeah, it's interesting. As a reader, I had my own thoughts about what could have been going on in that scene. And I understood that what she was saying is that having a baby meant for her the hope of a normal future. And that meant a future. And I think that, and perhaps it was also as a way of leveling the playing field. There you were, two young women. You were pregnant with your third, and she wanted to have a third. So I imagine there was perhaps a little bit of that going on as well. And I wondered, that made me wonder what it was like for you to be sort of visibly healthy and growing your third child as your patient was expressing her wish to have a baby, and you both knew that was not going to happen. Was it really hard for you at times?
It was really hard, and one of the things about having a baby is outwardly the appearance everybody knows. And so the time when I knew that she was going to become aware that I was pregnant, I felt a little bit nervous about how she would react. And just true to form, she was so enthusiastic and happy for me, and I just think she was just such an inspirational person in that respect, because many people may have felt, angry or bitter, and if she did feel that way, she certainly didn't portray it. But it was difficult, and I often think about there's very little that separates us from our patients, and in any scenario, perhaps the tables could have been turned, and she could have been the physician, and I could have been the patient, living the nightmare that really she was living. And so I can really empathize with her, and I felt very sad for her, and I was acutely aware that I had something that she very much longed and wished for. And it's not really fair in life why some people have those things and then others have to go through the trauma of this disease. And so I was very aware of that as I became more and more pregnant.
So let me end with just a short quote from your beautiful story. You write, "It's an honor being present during some of the most intense moments in the lives of patients and their families that drives our work, which inspires us to search for answers to a disease that continually questions our knowledge and beliefs. But on that day by the lake, I saw something that the cancer my patient endured could not destroy. Strength and resiliency of the human spirit. I was reminded that with the arrival of spring comes a new hope." And with that, Melanie, I want to thank you for sending your absolutely beautiful essay to Art of Oncology.
Thank you so much.
So join me next time to hear another cancer story and for a conversation with Art of Oncology authors.